I am Sadia, year 1 student, is going to take your apex beat. Are you okay with this one? It will not cause any harm to you. Okay. So this one the consent, and this will carry marks at least 0.5. At least 0.5 marks. If you are not taking any consent, 5 marks, 0. Okay, so 0.5 marks, 0. So you have to do this one with at first you have to take the consent, and you have to say that you have to, because he already buka baju, right? Okay, so you have to say that you have to buka baju because I have to do this. You have to open the chest. Okay, finish. Can you see? Everyone can see? Okay. So what we'll do at first we have to do the inspection, right? Right or wrong? Yes. Inspection. So inspection. So you have to inspect. You have to inspect from here. Okay. Is there any symmetry, any surgical scar, any visible pulsation? Okay. Chest is movement symmetry or not? Can goes to here. Okay. Just take your respiration normally. Okay, so you can see here the chest expansion and relaxation as well, right? So inspection. So there is no deformity. There's no deformity in the inspection, right? So in the chest it is okay, no problem. Okay, now go for the palpation. So what we'll do at first? What we'll do? Sanitize. Okay. I have to, right? I have to sanitize. Thank you. Okay. Okay, and do one thing. If your hand is too cold, then try to warm it. And then, okay. Don't put this very warm, then the patient will just jump it like that. Okay, don't put it like that. So, you have to, okay. So, we are in the right side, right? Right side. So our main target left side. Our main target of examining the left side. So okay. So roughly we said that the if it is 2, 3, 4, 5. So this is the 5th intercostal space, right? This is the rough estimation of the 5th intercostal space, just like that. Okay. Don't consider is with the nipple of the breast. Don't consider it with the nipple of the breast, because it is a misinterpretation with the different kinds of females. Okay, because it is totally misconception, just below the nipple. No, cannot say like that. So better to explain it with the intercostal space. Clear? Okay. So now there we have to do this one just like that. Okay. So it is the general pulsation. Put your hand like that. General pulsation. Is there any pulsation that you can feel? General. Here. Okay. Here. Okay. Here. Any pulsation you can feel or not. So throughout the heart, I already felt. Okay. Now go for the apex beat. So apex beat, we know that it is the most lateral, most inferior, most outward pulsation. So you can feel it. Not feel it here, because it is not, should not be here. Better to feel it from that side. The thumb as well as your finger. Try to, because this one not so obvious that you have to. Okay, so try to locate it very carefully and minutely. Okay, there is some tapping should be there. Okay, some tapping. So you will ask your subject to go like that. Okay. It's just very much just step. Okay. So it is here. Okay. So when you find it, it is here. So you have to do just mark with a ball pen, not very big mark, just a little bit. Okay. So just okay. So here, just like that. Just so you can look at this one. So now what's your then next step? Count the Count the space. So this is the manubrium. So this is the second rib, right? So now this is second, third, fourth, and this is the fifth. This is the fifth, right? Here. So this is the fifth. So this is the second, third, fourth, fifth. Second, third, fourth, fifth. Clear? So this is the fifth intercostal space. Now the measuring. Measuring. I prefer the centimeter rather than inch. Okay. So this one, the centimeter from midline. This is the midline, right? This is the midline. So here, so from midline to here, it is 12 centimeter. Clear? And from mid-clavicular, the mid-clavicular is here, and this one the sternoclavicular, and this is the acromioclavicular, and this is the midline. This is the midline. This, and this is the midline. So this is midline. So it is not on the mid-clavicular line. It is 4 centimeter from mid-clavicular line. Clear? Yeah. Clear to everyone? Yes. It is very important for your OSCE. Very, very important for your OSCE. Locate the apex beat of the subject. You have to do all these things from the taking consent up to this measurement. Okay, so what's my findings? In inspection, there is no surgical scar, no visible pulsation, and thorax is symmetrically moved. During palpation, the apex beat is in the left fifth intercostal space, 9 centimeter from the midline and 4 centimeter lateral to the mid-clavicular line. Clear? Clear? Yes. Okay. Now go for the harsh sounds. Finish apex beat. Now go for the harsh sound. Nothing, just you have to heard. You have to heard and different location and different heart chambers, right? Different heart valves. So, and just remember one thing, you have to put your thumb at the carotid. Just this one. Okay, and then you have to just go through this one. Okay, just put, because you already find out your apex, right? Apex beat here. So here is the apex beat. Okay, so you have to differentiate which one is the first one and which one is the second one. So here, as well as the tricuspid one, that means fourth left intercostal space, then the pulmonary one, second left intercostal space, and the aortic one is the second right intercostal space. Try to find it out whether it is normal, whether any additional sounds are there, and which one is the first one that corresponds with the carotid pulse, and which one is the second. That's all. Okay? Thank you very, very much. And give thanks to your subject or patient. Okay? So that's all. So we can